Welcome to Adapting Class. If you perform an adult CPR on an infant, you will get this NCLEX question wrong. Let's break them down and exactly what the NCLEX is going to ask you, the differences between these two conditions, infant and adult CPR. Very important, straightforward information. Let's get to it. First of all, you have to know certain key things. Why do we have to know this? The NCLEX law of the CPR, right? It's very important in terms of critical thinking. These questions usually test your safety, your prioritization, and age-specific conditions. That's why you got to compare between an adult and a kid. One small details, especially hand placement or maybe compression depth or the ventilation rate, can basically screw you up. It's a simple, straightforward question, and this is a home of content simplicity. I'm going to make it so simple, you will never forget. So the first thing we're going to talk about, what is the classification? I broke it down so that you don't have to worry too much. You got to know the age group, where you place your hand, the compression depth, the compression rates, what is the ventilation, and then the pulse check. That's what they're going to ask you, and they will confuse you between the two. Like I said, this is a short video to make you more comfortable. When you see questions, it's going to be a select or apply. So you better know it, otherwise you lose some points. What is the difference? How do I know this patient is an adult? Key fact, write this down. I want you to write this down. It's very, very important. You have to be 1 year. So 1 year to puberty. This is the way they distinguish between the two. So 1 year, at least 1 year and above. So if you're 1 year and above, then you consider this individual an adult. Hand placement. What do you use? Do you use your finger or your hand? That's the key. Pay attention. I want you to write these two down. Where do you place your hand and what do you do? If you know the answer, just put it in the comment. If you're doing a CPR in an adult who is 1 year and above, where do you place your hand? And how do you place it? Pay attention. Two hands on the center. That's the key. Don't forget. Of the chest. That's the place you place it. Because for kids, it's different. Oh, and the lower half of the sternum. That's the location. So watch for this information on the question. Lower half of the sternum. This is where you place your CPR. You've done this multiple times. When you see a question, you don't want to give it to the NCLEX folks. They dare to trap you. But no, this is where you place your hand. Now, this is the biggest one. Compression depth. Who knows what depth you should compress for an adult CPR? There's so many information out there, but there's specific test information that they may ask you. You can put it in the comment, but I want you to pay attention. This word is very important. It can change the answer. At least is the key. If you don't see at least there, don't pick it. Compression depth for an adult. But how much? 2 inches or 5 centimeters. If you see 2 inches there and you pick it, it's wrong answer. Always look for at least 2 inches. That means you can go above that. Very important. And this is the trap. Compression rate. Whether you're a kid or you're an adult, it doesn't matter. Everybody gets 100 to 120, right? 120 per minute. So every minute you have to do this compression rate, 100 to 120. If you can at all, even if you're tired, we got to change you, but we got to get at least 100 and no more than 120. Very, very important. That's the compression rate. Very, very important. And my favorite is the ventilation. The ventilation is your compression and giving them oxygen. Because when you're doing CPR, you have to give the individual oxygen at the same time giving compression. The compression is designed to pump the heart, right? As you pump the heart, you need to oxygenate the blood that is coming out. And so we need to give them some ventilation, right? So compression and the breath will give you the ventilation because there's exchange of oxygen and carbon dioxide. So what do? You push compression 30 to 2 and 30, and you give them 2 ventilation. Remember, if you're alone, 1 rescuer, single or double, 2 people, it does not change. That is very important. Whether you're alone or there's 2 of you doing the CPR, is still the same. It's still the same. Cardiopulmonary resuscitation is the same. It does not change. Ventilation, 30 compression, and 2 breath. It does not change whether you like it or not. And a carotid, how do you check their pulse? The pulse is through the carotid. What are you looking for? 10 seconds. 10 seconds is the key. No more than 10 seconds. You want to be at most 10 seconds. If he gave you 5 seconds, it's good, but you should not go past 10 seconds. This is adult CPR in a very straightforward way. When they give you a question, it's going to be what? Select or apply. Don't lose that point. Remember the compression that at least 2 inches, and then the compression rate. This is the key. This is the buzzword I want you to write down, right? I want you to write this down. This is the key. The clue the NCLEX will give you is this. In the question, they're not going to tell you. Sometimes they will tell you it's an adult. Sometimes they won't tell you. You know that it has to be 1 year and above to be puberty. If they don't tell you, look for this buzzword in the question. A middle-aged adult. That's your clue, right? Or if your patient is found what? Unresponsive on the floor most of the time, if they don't give you the age, they're talking about an adult. And what should you worry about? 2 hands, no fingers, and your depth will be at least 2 inches. This is all you need for adult CPR, right? So that's the key concept I want you to pay attention to. And then we can compare it with the pediatric one, right? So we compare with the pediatric CPR. So it's pediatric CPR. What is the age group? What are we looking for? That's the key. What age group are we looking for in the pediatric patient? An infant. The key is less than 1 year. So if it's less than 1 year, that's the key. If you're less than 1 year, that's what you're going to be. That's the age group. This is where students lose points. Your hand placement. How do you place your hand? Do you use your fingers or your hand? Pay attention. 2 fingers, not your hand. If you use your hand, you're wrong. And it's where? It's just below the nipple line. I want you to write down. It's fingers. When you put your hand on the cage, you have a wrong answer. But when you put your fingers, most likely you're going to get an answer. So pick an answer choice that talk about fingers, and that's 2 fingers. And then how deep do you go? Not at least. All you do is like 1.5 inches or 4 centimeters. If the answer is not there, look for 1/3 of their chest wall. That's how deep you go, 1/3 the depth of the chest. Now, the compression rate doesn't change, okay? It's the same. Everybody get 100 to 120 per minute. So pay attention. That doesn't change. I'm putting a star there. It does not change. Where do they trap people is the ventilation. I told you, when you're pushing on somebody's chest, you got to give them oxygen. But for this situation, it changes. If you are alone, 1 rescuer, you get 30 to 2. But if 2 people come in, yeah, it changes to 15 to 2. So watch for that. Watch for that trap. 30 to 2 for 1 rescuer. If there's 2 people doing the CPR, 15 to 2. That's half of it. And that is the key. 30-2 for one rescuer, 2 people, 15-2. And that's what distinguishes between adult and infant CPR. Pay attention to that. And the pause also is the trick. Where do you check the pause? Where do you think you check the pause? Not carotid, it's the brachial pause. So brachial pause is where you check for an infant. That's very, very key. Therefore, if you look for a question, it said 3 months, 6 months, kid is found in the crib, you're dealing with a young kid. Don't put your hand on them, just put your finger on them. 2 fingers and a brachial pause is the key. Otherwise, you get our questions wrong. But this is the easy, straightforward question. You don't want to mix it. It's a select and apply, like I'm telling you, that's the only way they can test your knowledge on this question. And it's a freebie. You should get it and then move on. Now, this is the memory trick. I feel like it's easy for you to use it to if you forget about it. Well, for infant CPR, it's a tiny body. It's not a big person. It's a tiny tool. Therefore, use the tiny tool you have. And what is that? Small chest. Since they have a small chest, you can't use your hand. Your hand may be bigger than your chest. So use your 2 fingers. That's the key, right? They have a small artery. You can't use the carotid artery. You got to use the brachial. And the same urgency. That means the same situation. Therefore, the compression rate is still what? The same, 100 to 120 per minute. That's the memory trick. Small body, small arteries. Don't put your hand on them. Just use your fingers, and then you get these questions right. And then we'll practice some questions, and you can see what I mean by that. Before we do the questions, these are my traps. Once again, in order to put all together. And I want you to listen carefully. These are NCLEX traps, okay? In the kid, this is mostly for kid or infant. Okay, let me put infant. In an infant, never use your hands. So no hands. Don't put your hands in them. Okay? The carotid, don't check carotid pulse. That's the way they will trap you. Brachial pulse. The compression depth, it should not be too deep, right? I said 1.5 inches. That's very, very key. The compression rate is still the same. So 100 to 120, right? And then when it comes to single rescuer and the double rescuer, that's the problem. If there's one person doing the CPR, then the ventilation is 30-2. And if there's 2 people, 15-2. Don't forget, don't lose this point. Straightforward CPR information that you should be able to get this point and run away from it. So that's the summary. We have 4 questions to test your knowledge on that. Same thing, right? Selected apply, NCLEX practice question. Basically, in the selected apply, SATA is basically what you expect. You have to be comfortable with the NCLEX SATA because you're going to get a bunch of them. Remember, you cannot choose everything unless there's 5 answer choices there. If you're confident, pick one. If that's what you know. If you know 2, pick 2 and move on. You get 2 points. But if you over select, and it's wrong, you lose all the points. You're likely to get 1 or 2 questions right from that. So this is what you have. Selected apply. Which action should the nurse take when initiating CPR, right? You read the question from the back. And then you go for the buzzword in the question, like I said. The buzzword in the question is what? They told you the kid is what? It's a 3-month-old. Therefore, you know you're dealing with an infant who is unresponsive. He's not moving in the crib. That's the buzzword I told you. And they check the pulse. The kid is not breathing and does not have pulse. Therefore, we got to do a CPR. Which of this do you think is appropriate? 2 fingers on the kid, just below the nipple line. Compress the chest at the depth of about 1.5. Use a compression rate of 100 to 120. Check the carotid pulse every 2 minutes. And then what? Check 2 hands on the lower sternum. What do you want to do? What do you want to do? What do you think? Put down your answer in the comments. Let me know. But which answer choice is right? What do you think? Of course, he's a kid. No hands. I see fingers. I'm picking it. and I make sure it's in the same direction. 2 fingers on the nipple, just below the nipple. And the depth is appropriate, not 2 inches, 1.5 inches. It's appropriate. Compression rate, like I told you, 100 to 120 is good. Yes, we check pulses every 2 minutes during CPR to make sure individual have pulses, but the location is inappropriate. Cardiac pulse is not appropriate for what? A kid. Therefore, that's wrong. And I told you, don't use your hand. So I see the hand, I'm not picking it. So what are the right answers? Number 1, number 2, number 3. Do you want to pick all of them? No, you can just pick one if you know it. But I know you know all the 3, so you pick it. And these are traps, so stay away from it. That's the way you approach these kind of questions. Same thing. This is just to re-emphasize with the content, right? And make the questions not that difficult, just to illustrate the point I just made. Select or apply, read it from the back. Which actions are appropriate? An appropriate action for CPR. Who is the problem? Go for the buzzword. 45, at the back of your mind, is an adult. That's what? Collapses in the unit and is unresponsive. He has no pulse, right? We got to do CPR, right? That's all. Now, what am I going to do? What kind of CPR am I going to do? 2 hands, right? Center of the chest. I don't know. Compression the chest, what? At least 2 inches. I'm going to check a brachial pulse, right? And I'm going to maintain my compression rate 100 to 120. And then I will deliver 15 compression with 2 ventilation. So that's what I have. Is that okay? Is that right answers? Think about it. I give you a few minutes to think about it. Which answers will you select? Think about it. We already know the content. And I try not to trap you, but I put a little bit of trap. It's an adult. I'm not using my fingers. I'm going to use my hands. I see 2 hands. Okay, it's in appropriate position. Middle of the chest. I'm picking it. Compress the chest at least, the word at least. If I take this from here and I put 2 inches, if you see a question like that, don't pick it. If you say compress the chest 2 inches, don't pick it. It has to be at least. If there's no at least there, if you pick the answer choice is wrong. So these has to be there. There has to be a qualifier for them to be right. We don't check the brachial pulse. We have to check carotid pulse because it's an adult. We have to maintain compression, right? 100 to 120, right? That's constant. Everybody get what? 100 to 120. The ventilation rate, right? Compression and the ventilation, it does not matter whether you're a young, one person or not. It has to be 30 to 2. This is what? 15 to 2. This is for infant. Therefore, this is wrong. So right answer is 1, 2, and 4. Like I said, I'm trying to emphasize this because it's very, very important. You're not going to get this as not select apply unless they give you a prioritization question. That is very, very key. Now, this is a prioritization question now. Which action should the nurse take first? A nurse enter a room and find an 8-month-old infant. Is less than 1 year old. It's an infant, unresponsive, no breathing, right? And it's not breathing. Basically, they tell you there's no responsiveness. That's a clue that the kid is not doing well. Which action should you take? Should you check a carotid pulse, begin chest compression using 2 fingers, activate the emergency response system, and then check the brachial pulse for no more than 10 seconds? What do you want to do? What do you want to do? What do you think? This is prioritization. This is how they trap you. You have to go through your ACLS, BLS protocol at the back of your mind. 8-month-old, unresponsive, not breathing. What do you want to do? Hey, remember, let me give you a clue. There's an unresponsiveness there, and there's a breathing, right? It's not ABC, right? It's neurological. Neurological is the unresponsiveness, consciousness of the individual, and then they check their airway, and therefore what is left? That's the key. You have to check the pulse, right? We don't have access to the pulse yet. That's very, very important. Don't jump to compression because we don't know whether the individual has pulse or not. You can't put somebody's chest if they has a pulse. Therefore, when you see questions like that, it is ACLS question is very trappy. When they give you the first thing you do is what? Responsiveness. Don't forget about ABC. I know everybody talk about ABC, but the question is not going to say ABC. It will say responsiveness. That's your neurological status. Then we check what? Your breathing, right? That's what that's what they're doing. Breathing or airway, either A or B before them, right? Whichever you want to check, but just make sure the responsiveness is checked. They've done their responsiveness. They've checked the breathing. We got to check the individual pulse. That's the thing. Then we can activate. Because it's a kid, we cannot check carotid pulse. We have to do a brachial pulse. So number 4 is your right answer. And the last question. This is a 62-year-old collapsed in the hallway and is unresponsive. He's not breathing normally. What do you want to do? Check the brachial pulse. I intentionally did this to let you know you may be looking for some answer and explain that we got to go through the protocol. But the answer choice is not there. Don't pick the wrong one. I know the person collapsed, is not breathing, is unresponsive. What is your priority? They say check the brachial pulse. Begin chest compression, right? At least 2 inches. Provide 2 rescue breaths. Obtain AED. What would you do? This is a trappy one, but it requires some critical thinking that you don't just jump the gun. You pick what you have. You can't say, I need this answer there. What would you pick? 62 is an adult. It's not breathing. Unresponsive. What do you think will be your answer? What do you think should be your answer? Like I said, don't get trapped from it. We know we got to do something. What would you do? I know I got to check a pulse. Well, the pulse doesn't what? It's not brachial. So I'm not picking it. Just because they put pulse there doesn't mean I got to pick. You got to check cardiac pulse. You don't check a brachial pulse in an adult. Therefore, if it's not there, I'm going to do chest compression. I don't need to do rescue breath because he's not breathing. And somebody is going to go get an AED. Pay attention to this kind of question. You're looking for certain answers. It's not there. You just deal with what you have. Just because you know, hey, there's no pause. I think we got to do pause. But the brachial pause is the wrong answer. It should be carotid pause. But there's no carotid pause. Well, we just do chest compression. And it has to be at least 2 inches. This is adaptant class. Like I said, very short difference between these two things. Once again, to recap, remember, if it's a kid, an infant less than 1 year, your 2 fingers and the brachial. And if it's a single rescuer, 30 to 2. If it's 2 people, 15 to 2. The compression is going to be 100 to 120. The depth for kid, 1.5 inches. Adult, at least 2 inches. That's the key, at least 2 inches. Otherwise, compression rate 100 to 120. When it's 1 person or 2 people, it's going to be 30 to 2, not 15. Don't pick it. And your hands is the best thing in the middle of the chest. Okay? Who is an adult? 1 year and above. Who is a kid? Less than 1 year. That's the infant. Easy way to understand the difference between these two conditions. Thank you for watching. Hopefully, when you see this kind of question, selected apply, you're doing your Q bank, you get 1 question right, all of them right. Take care and have a good day. If this video helped you, just put a click down and say like it or share it with your friends. Take care of yourself. Bye-bye.